So I hope you can see the PPT.
Yes,
Yeah,
Kat.
yes.
So last class we were doing about the communicable diseases. We did smallpox, chickenpox, measles, polio, infective hepatitis. And after those topics, the today's topic will be enteric fever and something about the parasitology, a few of the parasitology, and this is transmitted from the animals, that is the zoonotic diseases. So starting with enteric fever, which is actually including typhoid and paratyphoid fever, another name for the typhoid and paratyphoid. So this is a systemic infection mainly by Salmonella typhi, and the disease is characterized by continuous fever for 3 to 4 weeks. There will be relative bradycardia and involvement of lymphoid tissue, especially the lymphoid tissue, the Peyer's patches in the intestine that will be affected, and constitutional symptoms like anorexia, nausea, vomiting, then malaise, all those constitutional symptoms. The term enteric fever includes both typhoid and paratyphoid. Man is the only known reservoir of infection, that is either cases or carriers. Source of infection will be, though man is the reservoir, the organism, the bacteria will be shed via his feces. So the primary source of infection will be the feces. In the initial week, the organism will be shed via the urine. So even feces and urine of the cases and carriers, that is the source of infection. The secondary sources are contaminated water, food, fingers, and flies. So primary one is feces and urine, and secondary sources which is contaminated food, water, fingers, and flies. The contaminated with either the feces or the urine of the cases and carriers. The highest incidence is usually seen between 5 to 19 years of age. The typhoid fever doesn't confer any solid immunity. It doesn't mean that once you get the typhoid, you are permanently getting protected from a secondary or second infection. Not like that. It can come frequently. Incubation period usually 10 to 14 days. So the mode of transmission and the clinical feature. Mode of transmission, as we told already, because the source of infection is the feces and the urine. So how it is getting contaminated with the things. So feces and urine from cases of carriers when it is somehow getting contaminated on the water, soil, flies, and fingers, then getting transmitted to the food, either raw or cooked, and then when people are having that. So that is the mode of transmission. And this is actually affecting, it is a disease that is mostly affecting people of low socioeconomic group, though we cannot say exclusively. It is more related to their hygiene practice. But somehow hygiene practice may be also related to overcrowding, the socio-economic factors. So that is why this can be another disease which is more related to poor hygiene, low socioeconomic condition, overcrowding, etc. The clinical features will be the chills and high fever. There will be malaise, headache, cough, sore throat, and often with abdominal pain and constipation. The fever will be increasing in a stepladder fashion. Like a stepladder, it will be going on increasing. That is the fashion. There may be marked constipation, especially in the early stage, and later to that constipation, it will appear the diarrhea, and that diarrhea is called as pea soup diarrhea. If there are no complications, usually the patient will be relieving all the symptoms after 7 to 10 days. But in some people, it may go into complications, especially like splenomegaly, bradycardia, dicrotic pulse, and occasionally meningismus. So some people, mostly, most of the cases, it will be limited to the GIT with some constitutional and GIT symptoms, and then relieving after about 10 to 12 days it will be relieving, but in some people there may be, as mentioned, these complications. Along with that, sometimes intestinal rupture can also happen, and if that is the situation, mostly the situation is going towards very grave condition. Then the disease typhoid is also characterized by a special rash, and that is called as rose spots. So it can be asked in a MCQ. Rose spots is seen associated with that dash disease. So it is in typhoid, and that is usually seen in the second week of disease. And it will be more visible in those people who are having a light complexion. So the complications, as mentioned earlier, that can happen, but also intestinal hemorrhage, urinary retention, pneumonia, thrombophlebitis, myocarditis, psychosis, cholecystitis, nephritis, and osteomyelitis. Among all these complications, please remember the one that I have colored, intestinal rupture or hemorrhage, and also osteomyelitis. These are two important complications following typhoid. Not every patient will develop, but only those people in whom there is some toxic symptoms developing. Toxic symptoms like the bradycardia, hypotension, and the pulse variation. In them only, these symptoms will appear, the complications. How to control the typhoid fever? Because here we saw it told that man is the only reservoir, and as I told you in the last class, when man is the only reservoir, the another meaning of that sentence is then it is easier to control. If the vaccine is if there is a vaccine and then that vaccine is very effective, and if the coverage of that vaccine is very high, we can control or even terminate that disease. That is the concept of having only one reservoir. So, in that manner, typhoid should be amenable for controlling or prevention, but it is not that easy. One of the most important reason is the carrier. The carriers in typhoid cases are very high. Now, you might be remembering typhoid Mary. I have already told you that story. You might be, so I'm not repeating, but you know that lady, she was going on spreading. She was working in restaurants and she was going on spreading typhoid to all the people. So at the stage, she didn't know she was carrying, but after some time she knew. But because of her comfort in working restaurants, she continued working over there. And in her lifetime, she had transmitted typhoid to a lot number of people. So the carriers in typhoid, and because the carriers don't show the symptoms, that becomes the very great threat. If they don't show the symptoms, we will never understand that in their feces or in urine the organism is shed. We never understand. And if they are working in like this restaurants or somewhere, the food, water, everything is being dealt, and if they are not keeping the hygiene, they can spread the disease easily. So it is very difficult to recognize the carriers, the typhoid carriers. That is why controlling this disease is not easy from the reservoir of infection aspect. From that aspect, though man is the only one from which the disease can get transmitted, because of the increased number of carriers, it is not possible to control that disease. Then the other things possible is to maintain hygiene, control of sanitation, and also immunization. So in case of control of reservoir, if we know that the patient, it is a typhoid patient, we can go for a early diagnosis or try to diagnose. We get the clue, then itself go for a early diagnosis. Then if it is typhoid, better to notify because it is a transmissible disease. Isolate the patient and for the early treatment. Um, and here I wanted to say one thing, my own experience. I actually had typhoid when I was studying in seventh standard. In seventh standard, I went to Chennai. So I had foods from a restaurant over there. It was not the food; it was actually the water, though it was warm water. Still, I had the infection. So when I returned from Chennai, because the incubation period is for 10 to 14 days, the Chennai trip went very nice. It was for about 4 5 days. I didn't have any complaint during the Chennai trip. Then I came back 1 week later. One day I developed the fever, and it was going very high. Like they say, the step ladder fever. It was very, very, very high. My body will be burning hot. It was 103, 104 at that time. So I took local some remedies, maybe paracetamol. I don't remember. Mom initially gave me thinking it might be some fever, and her usual house made remedies, but it didn't work. Then on the third day, I was taken to one local doctor, MBBS doctor. She gave some antibiotic, but even though I was taking antibiotic, there was no improvement, and the symptoms were getting worse. So maybe in 1 week, so 1 week passed, but I'm having the chills were too high, and also the temperature. And then I was taken to my uncle, who is an MBBS doctor. So when he heard the thing and he connected that my recent Chennai visit and the incubation period and the temperature has not fallen down for the past 1 week, even after taking the antibiotic, the other MBBS doctor prescribed, he asked to do a urine sample testing because his clinic itself had a lab associated. So my urine was tested at that time and I was diagnosed with typhoid. So, as early as possible, the diagnosis should be made. Um, and then he gave the typhoid specific remedies, okay, if to know after what happened. But still, I had fever for 3 weeks. 3 weeks it took. Only then it started. I mean, the third week was like a convalescent week when every symptoms were coming down, the fever finally coming down. I had anorexia, and because of anorexia, I was not eating anything. So I can't say it was constipation something. Otherwise, also I didn't want to go to toilet. That's all I remember. The fever was too high, and the chills. Those were the symptoms that I remember from that. I don't remember any rashes appearing, but those were the symptoms. And third week, 2 weeks it took, and third week completely it was going towards the convalescent period. So then the carriers, as I told you, they are the ultimate source of typhoid fever. So their identification is very difficult, and that is why we are not able to control the typhoid fever properly. If you are able to identify and treat them, that is one of the most radical way of controlling typhoid fever. But that will be always remaining as a big challenge. Control of sanitation, that is the drinking water supply, the improvement of basic sanitation, promotion of food hygiene, hand washing, all those things. And immunization, there are two types of vaccine, anti-typhoid vaccines. The first one is VI polysaccharide vaccine, usually given for individuals more than 2 years. Revaccination is recommended every 3 years, but usually this vaccine is given as like a co-administered with other vaccines for the international travelers when they are people who are working in WHO, UNICEF, or whatever. When they are going, or even a tourist when they are going to international traveling, especially in those areas where typhoid may be endemic. I'm not sure in your case whether you might be required. It may not be mandatory, but maybe you will be suggested when you're going to India to take this vaccine. Maybe you may be suggested. So those people who are going for an international traveling, they are advised to take this vaccine. Then there is TY21A vaccine, which is orally administered. This can be given simultaneously with other vaccines, including vaccines against polio, cholera, yellow fever, or the measles, mumps, and rubella MMR combination. Though this vaccine, sometimes the health system they say to give for the young children when they are going for other vaccines to be taken. But it is not coming under the routine immunization schedule as it is being told, because it doesn't confer any lifelong immunity. Even the infection doesn't confer any lifelong immunity. So there is no meaning in taking the vaccine, believing that it will be giving a lifelong immunity. It is not going to give. And usually it is a controllable condition. It is not all the people will be going towards the complication. So usually, though there are two vaccines, the TY21A vaccine, it doesn't come under oral the immunization schedule for the infants, and the other one is usually advised for the people who are in traveling like that. But however, you have to remember the name of these vaccines uh, because it may be asked for a MCQ. because the TY21 may be from typhoid TY, you can connect it, but the other one, unless you learn, you will never understand this is a typhoid vaccine. The second condition for today is dysentery. So it is an infection of intestine which causes bloody diarrhea. It can be caused by parasite or bacteria. If it is bacteria that is causing, we call it as bacillary dysentery because it is the bacilli, the rod-shaped bacteria which causes, and mostly it will be Shigella variety. And Shigella variety dysentery, we call it as bacillary dysentery. And then we have the parasite dysentery. And the most important parasite which causes dysentery will be the Entamoeba histolytica. So that dysentery is called as amoebic dysentery. The symptoms can show up 1 to 3 days after infection, and this is usually in case of bacillary dysentery. Amoebic dysentery may take a little more days as a incubation period. The bacillary dysentery symptoms will be diarrhea with abdominal cramps, fever, nausea and vomiting, blood or mucus in the diarrhea. And in case of amoebic dysentery, it will be nausea and vomiting with fever. Along with that, amoebic dysentery, you might be remembering it will be forming that hepatic abscess, etc. So the liver is a area of predilection. So there will be pain in the upper right part of the belly, especially to say the right hypochondria, where the liver is there because of the liver inflammation. There will be pain in the upper right part of the belly with a swollen liver because there will be hepatomegaly and associated weight loss will be there. But bacillary dysentery is more of an acute type with blood or mucus in the diarrhea, and the whole abdomen will be paining, the abdominal cramps will be there. But in case of amoebic dysentery, along with the GIT symptoms, um, and here more than the diarrhea, it is the nausea and vomiting that is prominent in amoebic dysentery, and the pain will be specifically in the right hypochondria with weight loss. Um, and amoebic dysentery can go into complications like the hepatic abscess and also extra intestinal manifestations. Now, how to prevent dysentery? There is no vaccine, so the control measures, the sanitation, that will be the ideal thing to do. So if you're visiting a tropical or a less developed country where dysentery spreads easily, follow these tips. I want to keep it for yourself, your knowledge before you go to India. Drink and brush your teeth with bottled or canned water only, not tap water. Order your drinks without ice. Only eat raw fruits and vegetables that have a peel. Don't eat food from the street vendors. And when someone close to you has dysentery, wash your hands often with soap and warm water or use a hand sanitizer. Don't share towels, cups, or other personal items with the person. Wash your hands before you cook or eat. So, leave that. The first things that you have to always keep in memory while you are in India. So, just a picture or a diagrammatic presentation of what we were saying now. Yeah, do avoid unpasteurized milk and dairy products. Don't eat from street vendors. The street food in India is so attractive, but never go towards that. Unless you have a surety in your immune system, don't go. And consume water that has been boiled 1 minute. Even I would advise you to take your own electric um, water boiling that thing. So even if from the college, from the canteen, you will be getting boiled water for your safety, you can boil it again and then drink. Only then you drink. The third one is cholera, another GIT disease, the disease that is affecting the intestines and causing watery diarrhea. So cholera is an acute diarrheal disease which is caused by Vibrio cholerae O1, which is classical or alter variety. We have dealt with earlier PPTs, many of the modules. There is O1 and based on their uh, somatic antigen, yeah, O antigen. There will be classic and alter variety and also O139. Typical cases, they will be having the symptoms of profuse, effortless, watery diarrhea. And we have seen the pathophysiology also, how this watery diarrhea is happening because of that GAMP activity. And follow to it, there will be vomiting, which is also effortless, rapid dehydration because of the loss of water like this, muscular cramps, and suppression of urine. Mode of transmission, it is the disease, cholera is transmitted. Of course, you know it is due to the contaminated water or food. So the water which is contaminated fecally, or even the person who is having cholera and he has not washed his hands proper, or the people who is living with him and they are coming taking water from a public water tank or something, and if they are not maintaining that proper hygiene, it can be spread to the people in the vicinity. Contaminated food and drinks, even bottle feeding, it could be a significant risk factor for infants. Direct contact can happen from person to person through contaminated fingers while carelessly handling excreta and vomit of patients, and contaminated linen and fomites. Now, how to control it? Once you get such a case, have to immediately diagnose, verify the diagnose whether the person is having cholera itself. And once it is confirmed that it is cholera, notify. Notify to the government or the district medical officer, whomever concerned, that cholera has been uh, diagnosed in this particular area. Then it should be early case finding in that locality. The people, the epidemiological people, concerned people should go and find out the active case finding, starting from the that home in which the patient is the people in that house, monitor them, and also in the vicinity. Then establishment of treatment centers, because usually if cholera happen means it is going to be an outbreak. And if it is an outbreak, there should be treatment centers in that local area itself rather than bringing them to another hospital. It will be ideal to have the treatment center in that area itself. Provide them rehydration therapy, epidemiological investigations. Epidemiological investigations means all that WH questions. Who was having the first infection, in which house, which area, how many people over there, how it came, are they using common water source? Is anyone else in that area is using that water source? What were the age group which was most frequently or most severely affected? So all those WH questions, the time, the season, the duration, all those things, that is the epidemiological investigation. We need to do that. Then sanitation measures for the sanitary disposal of the feces, water, maintain its hygiene, its disinfection, food sanitation, etc. Vaccination, two types of cholera vaccines are available. One is Dukoral or WCRBS, and second one is Sanchol and M or C ORC vax. As like I told, for the typhoid vaccine, you need to remember these names also because it matters. In the MCQ, they may put one of the vaccine name and ask which disease it is associated to. One second. So for cholera, what I told, drink and use safe water, hand washing, clean the kitchenware with soap and safe water, wash clothes away from the drinking water source, and even the toilet, that minimum distance that has to be kept from the water body. Clean and disinfect your toilet or latrine, and also hygienic, maintain hygiene during cooking process. So that is with the GIT infections, the communicable diseases which causes diarrhea, dysentery, etc. Now we go to the zoonotic diseases, animal diseases transmissible to man. So they are the actually zoonotic diseases. If it is spread from vertebrate animals to human being, we call it as zoonotic disease. And if it is the invertebrate or the arthropod or the insects that is involved, uh, then we call it as the arthropod borne infections. So though in this chapter, the 10th chapter, it has been advised, or in the course outline, it is given only animal diseases transmissible to man. The most important that diseases that we have to study will be rabies, brucellosis, and leptospirosis, most commonly seen and most dangerous also. But in this, I had kept even the mosquito or the vector-borne diseases also, because these diseases are very common in Malaysia. Not yellow fever, this one, dengue, chikungunya, and Japanese encephalitis. So I put also those diseases because it is relevant to the health scenario of Malaysia. So these are the conditions now we have to see. So starting from rabies, it is also known as hydrophobia. It is an acute, highly fatal viral disease of the central nervous system caused by Lyssa virus type 1. Now, I'm not sure whether rabies is that common in Malaysia because here we don't see the stray dogs because of the cultural things that is associated. But rabies is one of a very dangerous disease, and we should know about its controlling. An important um, zoonotic disease. Rabies is one of the most important. That's why I put it over here. So rabies is also called as hydrophobia, and it is caused by a bacteria which is bullet shaped. Remember the term bullet shaped, and it is neurotropic RNA virus, which is called as Lyssa virus type 1, belonging to the family uh, belonging to the family Rhabdoviridae, serotype 1. Neurotropic RNA virus means they are RNA virus and they have a predilection towards the nervous tissues. So it is primarily a zoonotic disease of warm-blooded animal, particularly those of dogs, cats, jackals, and wolves. It is transmitted to man, usually by bites or licks of rabid animals. Classical hydrophobia is clinically characterized by long and variable incubation period. It can vary depending on the duration. Like the days also will vary. Sometimes it can be just a few days to even years. And also it depends upon the site where the dog has bitten, the dog or any other rabid animal where it has bitten. So if it is bitten on the leg region, the infection to reach into a rabies condition will take considerably more time when compared to the bite that has happened on the facial region. Because the main problem with rabies is, that the organism will be moving towards the CNS and producing the nervous system related symptoms. So if the bite has happened somewhere in the uh, facial region, then the area for the virus to travel to enter into the CNS is very short. So the incubation period will be very less when compared if it is bitten in the leg region. And then it also depends upon the depth in which this biting has happened. If it was not a biting, it was just a scratching, then it will take considerably more incubation period. So the incubation period, it will vary from days to even years. And this is a disease which is characterized by encephalomyelitis and usually ending with the termination of life. Despite intensive care, it is the only communicable disease of man that is always fatal. And when I checked the in Wikipedia, like Google search, I saw only 2 or 3 people who have been saved until now from rabies. So the virus that is recovered from naturally occurring cases of rabies is called streak virus. And then we have another variety which is called as fixed virus. Now, there is written, I have written over there what is street virus and fixed virus, but without reading that, is anyone remembering what is the difference between a street virus and fixed virus? Anyone who is remembering? Because even this variety, the fixed street virus and fixed virus, uh, can ask as a short note what is the difference and what is the relevance, because it also matters somewhat similar to like that of poliomyelitis, the polio vaccine, the vaccine derived polio. So something is very important, not similar to that, but something is very important with the rabies vaccine and the uh, strains that is being used for the preparation of the rabies vaccine. So now you know, anyways, if the dog has bitten or even scratched, it is ideal to take a rabies vaccine. So we should know about the rabies vaccine, and we use a particular virus a variety to prepare that vaccine, and that is called as fixed virus. So there is street virus and also there is fixed virus. Like in case of polio, there was a wild polio virus and also vaccine derived polio virus, if you remember. So similar is like over here. Here the wild uh, virus, we can call it as a street virus, because oh, you can just remember, because this is usually caused by the stray dogs, so they will be even wandering in the street, so which means even the virus is wandering on the streets. So that is one variety, the wild variety of the virus which causes the rabies, that is the street virus, and that is actually the naturally occurring one which we see in rabid animals. It is very much pathogenic, and it shows a long variable incubation period, 20 to 60 days in dogs. So once the infection happens, even the dog will show the rapid symptoms, and in dogs to develop those symptoms, the incubation period will be 20 to 60 days. But we are not using this street virus to prepare the vaccine. Usually what the public health people or the scientists they do is they are taking that concerned bacteria or the virus and make it either the killed vaccine or the live attenuated vaccine. But in case of rabies, they are not using this street virus per se, because it is highly dangerous. So it is not advisable to inject the street virus or the wild rabies virus directly into our immune system. So what they do is they take this, if a rabid dog has been found, they take, because it is the CNS that is mostly affected, and in the CNS the causes something called as Negri bodies. This term now you might be remembering, we have dealt that in practice of medicine. Negri bodies, it is some in cytoplasmic inclusions or inclusion bodies that is formed in rabies in the CNS, and usually it is diagnosed post-mortem after the death when we do, because of the symptoms itself we are confirmed the person is having rabies, but after to his death also we can confirm by the presence of this Negri bodies. um, 1 second. So, to prepare the vaccine, what these scientists do is they take the street virus and then from that rabbit dog and then inject it into the experimental animal, usually the rabbit. And in that rabbit, it is going to show the rabbit symptoms, and then that rabbit will die. From that rabbit, they will again take this organism from that rabbit's CNS, and then they will inject it to next rabbit, and a series of such vaccination, not vaccination, inoculation, it happens. And at the particular stage, what happens, because this is a like a series of inoculation that is happening. So from one, like what we do, the dilution, the same, somewhat similar, but not the scale that we follow, but somewhat the same principle they are following. They are also diluting that bacterial, sorry, the viral effect. So after certain inoculations in a particular number of rabbits, what happens is the strength of that virus, it is going on decreasing, and then the incubation period will not be varied. Usually the incubation period will be between 4 to 6 days. So in case of street virus, when it get infected, the incubation period was 20 to 60 days. But when they serially go on inoculate from in rabbits, the serial brain to brain passage of the street virus, they will go on inoculate the rabbits in series. Then at a particular number, the incubation period will be reduced. It will become constant, and it will be usually 4 to 6 days. So you inject it maybe after 10, 15 rabbits inoculation. The 16th one will be developing the rapid symptoms in just 4 to 6 days. Though it is happening in 4 to 6 days, it won't be that severe, and that virus is not producing any Negri bodies. That that virus is called as a fixed virus, and the virus is isolated at that particular stage. And this fixed virus, it doesn't have the ability to multiply in extraneural tissue. It is comparatively safer to inject into the human body, and this fixed virus is used in the preparation of anti-rabies vaccine. So like the poliomyelitis, the wild polio and the vaccine one, but the polio is developing here, it is not that the rabies is developing, but the kind of virus that is used for the preparation of the anti-rabies vaccine is by this method. So the wild one, what we see in rabbit dogs will be the street variety or the street virus, and the incubation period is longer, 20 to 60 days. It will multiply in the CNS tissue, producing Negri bodies. But that can't be used for the rabies vaccine preparation, because it will be highly dangerous to inoculate that virus into a human body. So they have to serially dilute it. So the scientists inoculate it into a series of experiments with the rabbits, and at a particular stage, the incubation period will be reduced and more or less constant between 5 to 6 days. And also this particular variety will not be able to produce Negri bodies in the CNS or multiply in other tissues, extraneural tissues. So it is safer now to inoculate that particular variety of antigen or the virus into human body, and that is called as the fixed virus. The source of infection, it is actually the saliva of the rabid animals. Rabies in man is a dead end infection and has no survival value for the virus, because usually the symptoms are so obvious that we will be isolating the person. And technically, when we see if it is a disease that is transmitted from a rabid dog or a rabid animal by its bite or licking to another person, I mean to a human being, uh, in that manner, if we are going to see technically or theoretically, we can assume that if a man is going to bite, a rabid man is going to bite another healthy human being, the disease may be transmitted. But it is only theoretically possible. In the history up to now, such a man-to-man transmission has not happened. Maybe because the symptoms are so obvious, and then we isolate the person. He will be put in a different cell. Oh, that is a very tragic situation. Very, 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 very tragic situation. And yeah, so the human contact is never coming up once the person started showing the rabies symptoms. So it is only theoretically possible. In the history, it has not yet happened from man to man by biting, but it has seen that human to human transmission happens only when we are dealing with the infected organ or tissues, especially from donors to the recipients, like that if it happens. Otherwise, man to man biting and then transmitting, theoretically possible, but not in the history yet happened. So usually the rabies in man is a dead end infection. It is not getting transmitted to another person. Incubation period commonly 1 to 3 months following exposure, but may vary from 7 days to many years. That I told you in the previous slide. The incubation period is widely varying. It can just take few days to even years to develop. Just 2 or 3 months back, but most of the times, like in such a gap, I usually read such a news from India that a person passed away because of rabies symptom, and it was diagnosed, not diagnosed. Uh, the family realized that the person was bitten by the house dog itself around 2 years back. So 2 years back, he the house dog itself, the domestic one itself, he had bitten, not bitten, like scratched something, and because it was the dog, the pet dog, and maybe the dog was injected. I don't know. We don't get such news in the such details in the news actually, because it can affect even the claiming insurance, etc., etc. So we don't get the confirmed news. So it's not sure whether the dog was vaccinated or not. I'm not sure. But anyway, because this was a pet dog and it was just a minor scratch, the boy also didn't go to take a rabies vaccine. Maybe the pet dog didn't show any rabies symptoms also. But 2 years later, he passed away. This boy, but I means now that at the time he had become around 18 or 20 years, he passed away because of rabies. And they confirmed it was rabies because after the symptoms developed, obviously, and later to that they did the postmortem, I guess, then only. And then they were trying to remember, and then they remembered that 2 years back such a scratching happened. And because it was just a scratching, it took around 2 years for the symptoms to develop. So just mention that even have you have such animals, such pets, even small scratch, even licking. If it is intact skin, it's okay. But if it is not intact, there is a minor break or cut. Then also better go and take the prophylaxis or the vaccine. So the clinical features, there will be prodromal symptoms like headache, malaise, sore throat, fever, which is lasting for 3 to 4 days. So these symptoms is not giving us any clue. The initial symptoms, headache, malaise, sore throat, whatever disease we discussed, all the viral infections will be having the same symptoms. So it doesn't give any clue that it is rabies the person is having. 80% of the patient may complain a pain or tingling at the site of the bite. Then it is reasonably specific, somewhat specificity when the person is saying there is a burning or a tingling sensation at that particular area of biting, then we get a clue. But still, see, it is only 80% of patients who are having that symptom, the other 20% are not having that symptoms. So it is very difficult in the prodromal stage to understand the patient is having the rabies symptom. Then that should be followed by some other symptoms, especially when there is the involvement of CNS. There will be excitation and stimulation, and there is a order in which the symptoms or the CNS that is being affected. Initially, the sensory system will be affected. It will be highly stimulated. That is why even when there is a passage of air, they will be having aerophobia, and that is comparatively very much confirmatory symptom. Then there may be extra or exaltation of motor system. They will be having increased movements. Then the sympathetic and mental system. That will be so the order of development of the symptoms or the stimulation will be sensory, motor, sympathetic, and mental. You can remember that order. Good for a MCQ question. So the patient, because the sensory system is involved, the initial symptoms after to this prodromal will be he will be intolerant or sensitive to noise, bright light, or a cold draught of air. So that will be aerophobia, and that is considered to be pathognomonic of rabies. The symptoms are progressively aggravating, and then you will be having the motor system where the movements are affected. So all the attempts of swallowing liquid, it become unsuccessful. The patient may die abruptly during one of the convulsions or may pass on to the stage of paralysis and coma. But eventually, anyway, the person is going to pass away. So, how to prevent the human rabies? We have to consider it under three heads: post exposure prophylaxis, pre exposure prophylaxis, post exposure for the people who have been vaccinated previously. So, the better thing in case if it is rabies, ideally, though we also have our medicines, but ideally it is the vaccine, and mostly it is post exposure. Once you get the bite or like a licking or scratching, then go take the rabies vaccine. That's the commonest and the idealist thing that is happening. But in case you are someone dealing with the animals, like veterinary doctors, surgeons, uh, then people who are having pet dogs. Occupationally, if they are exposed to the animals, then they should have a pre-exposure prophylaxis. Even before that concerned animal is biting you, if you know that you have to deal as a part of your work with all these animals, then ideally a pre-exposure. Then post-exposure for those who have been vaccinated previously. For example, a veterinarian surgeon itself, he had already taken pre-exposure before joining his job or whatever. He had taken that pre-exposure vaccination. You may be remembering all this rabies vaccine will be having particular number, this much vaccine to be taken, 3, 4, or 5. It varies. And the days on which the vaccine has to be taken, that also varies. There are different regimen. We will see that. So if the person has already taken the vaccine and then he was working, and while at work, one of the rabbit dog or animal bit him. So then what is the dosage to be followed? That is the third variety, the post exposure treatment of the person who have been vaccinated before. So we'll start with the post-exposure prophylaxis. Usually, it's only when the dog bite us we go do that. So after dog bite, uh, the vaccine is very important. But before to vaccine, there are certain things that we should essentially do before even we take the patient to the hospital. Because when this happens, we have a general tendency to take the patient immediately to the hospital, but it is ideal to take to do these steps very essentially than taking him to the hospital. It doesn't mean that you have to delay taking him to the hospital, not that the bite happened in the morning and then you do things and then take him only in the afternoon or evening, not like that. But at the immediate site itself, better do these things, because these are very essential first aid steps to control rabies, and then immediately take him to the hospital. So after the dog bite, immediately wash the wound with soap and running water for at least 15 minutes. See the duration for 15 minutes, and that too with soap and running water. So it is not the water should be continuously running, because as much blood, if that bite was so deep, better to allow blood to flow off the water. It doesn't get clogged. So that is why use the water, the soap for a disinfection, and do it for 15 minutes, not 1 minute, 2 minutes, but 15 minutes. Do that. Disinfect the wound with alcohol or an iodine solution if possible. Immediately consult a doctor or go to the nearest health facility. So the first step, that cleaning for minimum 15 minutes with the soap and also running water, that's an essential step. I do this the first thing and then only take the patient to the hospital. Then after he has been taken to the hospital, the vaccine that has to be taken. So we have two rabies vaccine. One is cell culture vaccine, that is CCV, and embryonated egg-based vaccine, which is EEV. So later they will be using CCV and EEV terms only. It depends on how they have prepared it. The term varies. And when we are giving the vaccination, it depends on the category of the person also who got exposed. So we have category 1, 2, and 3. In category 1, there is only touching of feeding animals, licks on intact skin. So it has not touched, I mean, it is just, it has touched us, or while we were feeding or something, and licks on intact skin. It is not broken, on intact skin. So if that is the case, it is category 1. We don't have to take any exposure or any vaccine. Category 2 means a nibbling has happened, like when you were playing with the pet dog, then a slight scratch happening. Or sometimes I have seen people who are so close with dogs, they will even put their fingers inside the dog's mouth. I don't know what give them that confidence. Or sometimes they take the food in their hands and then ask the dog to eat from their hands. So at that time, that nibbling thing or playing with the dogs, so nibbling and that contact, which happened on uncovered skin, which is not protected with cloth or anything, minor scratches or abrasions, but without bleeding. This belongs to the category 2, immediate vaccination and also local treatment. What we told earlier, the local treatment plus the vaccination. And category 3 is everything else, single or multiple transdermal bites or scratches, licks on broken skin, contamination of mucous membrane with saliva from licks, contacts with bats, etc. Bats is highly dangerous, so even the slightest contact with them, they bite, doesn't matter if they are coming in contact. That belongs to the category number 3. So for them, we have to do immediate vaccination, the local cleaning of the wounds as like category 2. Along with that, we need to give a immunoglobulin also. So the vaccination is given plus the passive immunity, immunoglobulin, the ready-made antibody is also given, because here the category is third, very severe conditions, or it may develop into a rabies. So for them, immunoglobulin has to be given and then the local treatment. So first we have to categorize in which category that particular person who has been exposed to the dog is falling into, and then know the do the necessary steps. So we have two types of regimen, the SN regimen and also Zarib regimen. In case of SN regimen, it is 5 dose and 1 dose, that is one injection each on days 0, 3, 7, 14 and 28. So it can be IM, intramuscular, then it is 1 or zero point 0.5 ml, or it is sometimes, I mean, it can be injected on the deltoid or on thigh region. So day 0 is the day when the biting has happened, 5 doses. So 5 vials, 5 visits that is required. And if the person is belonging to the category number 3, day 0 itself, we have to give him rabies immunoglobulin. And if it is the Sareb regimen, it is 4 dose. 4 dose that is given, but on 3 visits, which mean 2 vaccines will be given on a particular day. So 2 doses will be given on day 0, the first day itself, one in each of the 2 deltoid or the thighs. And then it will be followed by 1 dose on each of the 7 and 21 days. So the first one, the ASM regimen, it is the 5 dose, 5 visit, 0, 3, 7, 14, 28 days. And on the day 0, they give the rabies immunoglobulin. And in Zareb regimen, it will be on day 0 itself, they give 2 vaccines. That day, if it is category number 3, they are going to give immunoglobulin also. Then after to that, there is no third day in the Zareb regimen. Instead, there is the 7th day. And in the SN, it is 14 and 28 days. Here we don't have 14 and 28. Instead, we have 21 days. So it will be 4 vials and 3 visits. That is the SN regimen and Sareb regimen. That is post-exposure. In case of pre-exposure, I told you the people who are exposed to the animals. It is recommended for anyone who is at continual, frequent, or increased risk of exposure to the rabies virus, either as a result of their residence or occupation. Pre-exposure prophylaxis schedule requires intramuscular doses of 1 ml or 0.5 ml depending on the vaccine type, and that is usually given on like the other one 0, 7 and 21 or 28 days, like the Zareb regimen. It is also given 0, 7 and 21, but here there is option 21 or 28 days can be given. I don't want you to remember the volume of the injection that is being given, but you need to remember the different names whether it is post-exposure or whether it is pre-exposure, and also the days on which the vaccine is given. So the SAREB regimen 037 1421 1428, right? 1428, and that is the ASIN, and the ZARIP, it will be 0721, and date 0, there will be 2 vaccines given. In case of post-exposure prophylaxis, people who have already taken this one, the pre-exposure, in case they are, while doing their duty, they are getting bitten by the dogs, then who have taken complete pre-exposure vaccine of 0, that 3 vaccines if they have taken, then they can be given 1 dose of CCEEV, which is a combination of both intramuscularly, or a CVV intradermally on days 0 and 3. So either 1 dose if it is CCEEV or CVV on days 0 and 3. That is sufficient. They don't have to go for the 5 vaccine or the 4 vaccine. They don't have to. Either 1 dose or 2 dose will be enough. So that is about the rabies. The second one is brucellosis. Brucellosis is a bacterial zoonotic disease, and it is also known by a variety of names: undulant fever, Malta fever, Mediterranean fever, etc. It is usually transmitted to man by direct or indirect contact with infected animals. It is caused by different species of the Brucella group, and it is characterized by intermittent or irregular febrile attacks. Along with that, there will be symptoms of profuse sweating, arthritis, and an enlarged spleen. So usually brucellosis is a disease that is circulating or transmitted from animal to animal, but this can accidentally get infected or get transmitted to a human being, mostly because of the occupation in which he is involved. So there are 4 types of brucella: Brucella militensis, Brucella abortus, Brucella suis, and Brucella canis. So Brucella militensis is the most commonly found one. It is the most virulent and invasive variety, and usually it infects goats and occasionally sheep. You need to remember this variety also, that militensis is usually seen in goats and sheep. Then abortus, this is going to produce abortion, and it is usually seen in cattle or the cow, and it is less virulent. Brucella suis is actually intermediate in virulence, that is in between militensis and abortus, and suis, which means it is related to pigs. So people who are like a pig, domesticating people. So because of that mishandling, they can have this infection. Then Brucella canis, canis canine, which means this is seen in dogs. So remember the 4 varieties and in which animal it is seen, maybe asked for MCQ. Reservoir of infection, here, yeah, the reservoir, even in case of rubella, rabies, the dogs, cats, bats, etc. were acting as reservoir, so it is not easy to control the disease because other animals are also involved. So same here also, main reservoirs are cattle, sheep, goats, swine or pig, buffalo, horses, and dogs. In animal, the disease can cause abortion, premature expulsion of the fetus, or even death of that infected animal, or even the death of the fetus also. The infected animal excretes brucella via its urine, milk, placenta, uterine and vaginal discharges. So usually human beings get infected when, as a part of their occupation, they are dealing with the delivery process of those infected animals. At that time, there is big chances to get contaminated with the placenta or the other uterine or vaginal discharges. So the disease get easily transmitted. The animals may remain infected for lifetime. So the host factors, because it is mostly occupation related, the farmers, shepherds, butchers, abattoir works, uh, veterinarians, and lab workers. Those are the people who are mostly affected by these symptoms. Brucellosis is most prevalent when standards of hygiene are not met in domestication. Overcrowding, high rainfall, lack of exposure to sunlight, unhygienic practices in milk and meat production all favor the spread of brucellosis. So, mode of transmission is usually from infected animals to man, and via contact, as I told, the direct contact with all those discharges, the tissue, blood, urine, vaginal discharge, aborted fetus, the placenta, everything. When the person is getting into contact, and if they are not maintaining proper hygiene, not protecting with a gloves or other protective clothes, then they are going to get infected if the animal is infected. Then it can be foodborne also, not direct contact, but foodborne, especially if we are going to consume, if the cattle is infected and we are going to consume the raw milk, the raw meat, it can result. So indirectly by the ingestion of raw milk or dairy products from infected animals. Even fresh raw vegetables can also carry infection if grown on soil containing manure from infected farms. This we have seen earlier also when we were doing the chapter on environmental health, the manuring. People, if they are bringing manure from uh, the houses which have domestic animals, and they are not doing the proper treatment, not proper composting, then there is a problem that even the vegetables can be affected. I mean, infected, sorry. Then it can be also airborne infection because the environment of a cow shed may be heavily infected. Brucella may be inhaled in aerosol form in slaughterhouses and also in laboratories because they are discharging their organism via even urine. So when the urine is flowing, it can the can be drops that is spreading, and then the organism is spread and it will be suspended for a while. That is why it is airborne infection. So even when we are exposed to that aerosol, we are inhaling in, that is the danger. And then when we are cutting the in a slaughterhouse, when we are not maintaining the hygiene and then slaughtering those infected animals, even in laboratories, if we are not maintaining the protocol, then we can get infected. Incubation period is very variable, usually 1 to 3 weeks. The acute phase is characterized by sudden or insidious onset of illness. And the symptoms will be swinging pyrexia up to 40 to 41 degrees Celsius. There will be chills or rigors and also sweating. There will be arthralgia and arthritis, usually monoarticular, that is only single joint is affected. And mostly that will be larger joints, hip, knee, shoulder, ankle, etc. Then there will be low back pain. There will be headache. There will be insomnia, and also splenomegaly and hepatomegaly. There will be leukopenia with relative lymphocytosis. Leukopenia means the WBC count will be decreasing generally. The all the other WBCs except lymphocyte. Lymphocyte will be increasing, and this one, all the WBC except the lymphocytes, that will be decreasing. It's just a PPT showing all the features, I think. So brucellosis is the name given to a bacterial infection, which is basically contracted from animals due to consumption of unpasteurized dairy products. There will be fever, chill, weakness, lethargy, muscle and joint aches and pains, and also headache. Then how to control? Control mainly it will be in case of animals because it is animal transmitted. So once we are confirmed that this particular animal is having brucellosis, don't think any otherwise because it is forever that animal is infected. So slaughter him or kill it. So that is the best thing. Case finding to be done in mass service, like wherever the animals are being done or domesticated, the cattle, the pig, everything. We go there, find the case, and animal those who are infected with brucellosis have to be slaughtered and then give full compensation paid to the farmers. Otherwise, the farmers will not be allowing for this, but they don't understand because in animals it is going to produce the symptoms of only abortion and the death of the fetus. So the farmers may not be convinced why to kill these animals. So they have to be killed and full compensation to be given. This is the only satisfactory solution aimed at eradication of the disease. Vaccine is present only for the Brucella abortus strain 19. Then hygienic measures, so obviously to clean sanitary environment for the animals, sanitary disposal of urine and feces, veterinary care of animals. In case of humans, early diagnosis and then necessary treatment. We should take in the pasteurized milk only and also the dairy products. We should be very careful that it should be made from the pasteurized milk. Then only it is safer to take. And protective measures like to prevent the direct contact with infected animal. People who are farmers, shepherds, milkmen, abattoir workers should wear protective clothing when handling carcasses or the dead bodies. Exposed area of the skin should be washed and soiled clothing renewed. Vaccination is the for the Brucella abortus, which is 19BA, is available. So BA also you can understand it is Brucella abortus variety, but still I would say you to remember this vaccine name, like many other vaccine names I told you. Remember this vaccine name. Brucellosis would disappear if it were eradicated from animals. And it is not easy because we have to slaughter a lot of animals, and the farmers who are depending on those animals, they are not going to agree. Have to convince them. That is why we have to compensate them fully so that they get agree. But still, whenever a reservoir, if it is only man, then it is easier. But in that man or in those diseases, if carriers play an important role, then it is difficult to control. And if the reservoirs are organisms more than 2 man, then also the controlling is very difficult. The last one among the zoonotic disease is leptospirosis. So it is a bacterial disease which affects human and animal. It is caused by the bacteria belonging to the genus Leptospira. The disease symptom range in severity from mild febrile illness to severe and sometimes fatal disease with liver and also kidney involvement. So there will be fever, chills, rigor, etc. Along with that, there will be some kidney symptoms. Kidney symptoms is more prominent, and also some liver symptoms. Uh, Hepatomegaly can be the then yes, some urinary symptoms also. Weil's disease is one of the many manifestations of human leptospirosis. The main agent is Leptospira interrogens. The source of infection is the urine of the infected animal. Animal reservoirs, it's mainly the rodents. So the rats will be the like rats, mice, and wolves. And domestic animals like cattle, sheep, goats, water buffalo, pigs, and horses. They also can be infected through grazing in areas contaminated by the urine of the carrier host. So this carrier host may be these things, the rats, mice, and wolves, or even the infected human being. So if they are going to, these animals, if they are going to cross in those areas, um, then they also can get infected. The leptospirosis, usually children are the one who are predominantly getting affected, or they acquire the infection more frequently from dogs than the adults. But in case if this is happening in adults, it is due to the occupational exposure. So if children are getting infected, most important reason is from the dogs. And if adults are getting infected, it is mainly because of their occupational exposure, where they are getting exposed to the urine of infected animals. Maybe they are farmers, the agricultural livestock farmers, people who are working in rice field, sugarcane field, and underground sewers, abattoir works or the people involved in slaughtering, meat and animal handlers, veterinarian, etc. So adults, if they are getting infected, mostly due to the occupational exposure, and mostly people working in rice fields, agriculture mainly, because especially this is a very important disease that is commonly seen. And actually, this disease is on a spectrum. It varies from the mild variety to the severe variety. The severe variety is usually rare, where the spleen, liver, kidney, everything will be affected. But mostly, it will be mild. Some symptoms will be associated, and very common in Kerala, especially during rainy season, because during rainy season it will be raining heavily over there, and then we have rice cultivation, also rice farming. And one of the feature of the rice farming is that paddy, that area should be completely covered with water up to the knee level or something. I don't know the exact, but that is the way the paddy has to be cultivated. Like that much water supply or water present should be there for the growth of the paddy. So when there is such a large quantity of water present, and people who are the farmers will be usually walking on barefoot in that area, in that paddy cultivation. So if there is mice infestation over there, and the infected mice has passed urine, and when the person is walking, and if there is mild abrasion, the the bacteria can enter into his body, and then the infection can result. So it is very commonly seen in India, I mean in Kerala, during rainy season. And once the people know that the patient go to the hospital, and the doctor get to know that his occupation is that particular, the farmer working in paddy field, rainy season, they will immediately, they don't wait for the other symptoms to come up. They will usually start with the, if these symptoms are there, like the occupational exposure, um, then they will start with the treatment for leptospirosis. So mode of transmission, the direct contact, leptospira can enter the body through skin abrasions and also through mucous membrane, even if it is intact, because mucous membrane are so thin, delicate. So even if it is intact mucous membrane, it will get infected. But through skin, it should be some cut or minor abrasion should be present. Whenever the skin, the cut skin or the intact mucous membrane, if it is coming into direct contact with the urine or tissue of the infected animal, the disease can be transmitted. Or there need to be an indirect contact, where there is a contact of the broken skin with soil, water, or vegetation contaminated by urine of infected animal, or through ingestion of food or water contaminated with leptospira. Can be also due to droplet infection. That is mainly through inhalation, especially when milking those infected cows or goats. Direct man-to-man infection is very rare. So for the controlling of the symptoms, I had not gone into the details about its clinical features. Yeah, some clinical features you can read from here, I guess. This should be the clinical features, I guess. You can see the organisms or the animals that are involved, the complications, I think, meningitis, that's a word I can read. It should be something prevention, is it? What is this one? Jaga Jankitan. What is that?
Sorry, which one?
This one. Jaga Jankitan and
Uh,
also Kara Jankitan. What is that?
Jaga jangkitan means preventing infection.
Okay, and what is this one? Kara.
How to prevent the infection? No, sorry,
Eh?
how it is
Transmitted.
infected, how infection happens.
Oh, okay, okay. Okay. And what is this Rawatan? That is clinic, na,
Treatment.
hospital? Okay.
Rawatan is treatment.
Okay, fine. So you get everything from here. That much is enough. As I already told, a little bit of symptoms and pathophysiology will do. Here, the main thing will be concentrating on the controlling, how we are going to control. So controlling it is the environmental measures. We should prevent exposure to potentially contaminated water, reduce contamination by rodent control, protection of workers in hazardous occupation, and also health education. Vaccination is there, but it is usually in countries like Italy, Russia, China, where people are involved in certain infections, certain occupations who have a high chance of getting infected. For them, the vaccines are available, but it is not mentioned what is the name of that vaccine. So that is with the vector, not vector, what is that? Zoonotic diseases. Now we go to the vector-borne diseases or the diseases caused by the mosquitoes. And there is yellow fever, Japanese encephalitis, chikungunya, and dengue. But yellow fever, I'm not going to take that because it is not seen in Malaysia. So I don't want to discuss that disease because this is endemic in certain parts of the world, especially the Latin American, the South American countries, and also Africa. But I didn't remove also. You don't have to study this. I didn't remove also because if ever I have to use the PPT somewhere else, some other course, then I don't have to prepare it again. So that is why I kept it. Otherwise, yellow fever, you don't have to remember or study it. You can read for your own. And one thing to remember over here is remember the name of the vaccine because in MCQ options also sometimes this vaccine may be kept. So 17D vaccine is related to yellow fever that you remember. And another thing just for curiosity or just for your information to remember is whenever we are traveling to a endemic area, the country that I told you, the African and also the South American countries, if you are traveling to the, we should have a vaccination certificate. Or we travel to the, and then if you are coming back to our home country, this is applicable for Indian also, Indian passports also, and also I have seen in Malaysian passports also. When I reach the airport, I have seen there is a separate queue for the people who are coming from countries in which yellow fever is endemic. When you're going to India, you don't have to take the vaccination because India is also India is not having yellow fever. Even Malaysia is not there, so even I can travel, no problem. But these African and Latin American countries, if we are traveling there, you have to take a vaccine and then only you can go there. Or when you are returning from the maybe you got already infected. But when you are returning, there will be a problem. They won't allow you to come back to your own country or to leave the airport unless they are sure you don't have the disease. You will be stopped in the airport itself. Uh, and after that yeah, incubation period, how much days is that? Only a week, I think. I didn't keep the incubation period. It's only a few days. Uh, Only after that much days you will be allowed to come out. Yeah, 3 to 6 days. Only after this much days, 6 days, you will be allowed to come out of the airport. Just remember those two things of yellow fever. Otherwise, no need. Just keep and go to the next condition that is Japanese encephalitis. So JE is a mosquito-borne encephalitis caused by group B arbovirus or flavivirus, and it is transmitted by the Culex mosquito. It is a zoonotic disease, or rather a vector-borne disease, that will be the most ideal term to use, infecting mainly animals and incidentally man. JE is the leading cause of viral encephalitis in Asia and occurs in almost 24 Asian and Western Pacific countries. Transmission occurs principally in rural agriculture location where flooding irrigation is practiced. Flooding irrigation means the people actually in that particular crop area, like the paddy I told you, they will be pouring water in a very big level, not just like watering the plants, only giving some wet in that soil. That is not the thing. They are actually allowing water to flow through hectares of that farm in a big quantity, like a flood that happened. not naturally, artificially, that much. So where the flooding irrigation is done, there is, because the flooding irrigation means that much quantity of water is there, and then it is an ideal place for the um, these mosquitoes to breed and to multiply. So then that results in the disease. The disease is seasonal, the transmission, and mainly related to rainy season in Southeast Asia. And major outbreaks, this is another feature of JE. Every 2 to 15 years, there will be an outbreak. So in case in Malaysia, JE is an endemic in Sarawak. And if you go towards the immunization schedule, I didn't keep the picture, but in the earlier PPT, if you go through the immunization, you can see the JE vaccine is available only in Sarawak in Malaysia. And it is usually given at 9 and 21 months, and a booster dose at 7 years. But only in endemic areas, the JE vaccine is given. There are four major outbreaks that is reported. One in Langkawi in 1974, Penang in 1988, Perak and Negeri Sembilan in 1998-99, and Sarawak in 1992. And Sarawak, it is not just epidemic, it is an endemic. It is always present, that constant presence of JE is there. Initially, both adults and children were victims of JE in Malaysia. However, according to the current reports, JE infection is now lethal only to the children in Malaysia. Epidemiological features. JE virus infects several extra human hosts, whomever this Culex mosquito is going to bite. So many animals and birds can be infected. So the usual or the basic cycles of transmission is pig, mosquito, pig. Like an infected pig, a mosquito is biting, and then that mosquito is going and biting another pig. That is one cycle. Then it could be between the bird, mosquito, and bird. The bird variety is ardid bird. The disease is transmitted to man by the bite of infected mosquitoes. Man is an incidental dead hand host. So if this mosquito, instead of biting the pig or the ardid bird, they are accidentally coming and biting a human being. And usually, the Culex mosquitoes are possible. Of course, mosquitoes are possible in a human crowded area, yeah, your residential area. But this ardid bird or the pig, that is not easily present over a human densely populated area. So usually what happens is when people are going to the jungle area, they get bitten by these mosquitoes, and then uh, they come to the city and then can be transmitted. Or another way is the people who are staying or they're making their home near to the jungle areas. They are the most possible people. Man-to-man transmission has not been so far recorded. Animal host. Among the animal hosts, pigs have been incriminated as the major vertebrate host for JE virus. It is important MCQ. The pigs are involved. We will always remember only the mosquito. We will always remember, oh, it is a vector-borne disease, so it is the mosquitoes that is involved. We remember only that. But pigs are very much involved in Japanese encephalitis. Infected pigs do not manifest any symptoms of illness but circulate the virus so that mosquitoes get infected and can transmit the virus to man. So, wherever the people are domesticating the pigs, we need to be aware because the pigs won't show any symptoms. But virus will be multiplying in them, and then when the mosquito is feeding, and the mosquito is biting a human being, they will be having the symptoms. And JE, it is a encephalitis, encephalomyelitis, which can lead into CNS symptoms. So vectors, as we told, it is the Culex one. Incubation period varies from 5 to 15 days. The disease will be having three stages: the prodromal stage, acute encephalitic stage, late stage, and a sequel. So in the prodromal stage, like all the constitutional symptoms, fever, headache, GIT disturbances, lethargy, malaise, very, very indefinitive type of symptoms. And that duration is 1 to 6 days. Then acute encephalitis stage, it is usually very high, the fever, which is ranging from 38 to 40.7 degrees Celsius or 38 to 41. The fever will be fever, sorry, the prominent features will be that high fever. Along with that, because it is encephalitis, the neck symptoms, the nuchal rigidity, there will be stiffness in the neck region, like a meningitis, what we say, the focal CNS symptoms, convulsions, difficulty of speech, dystonia, the movement of the muscles will be affected, ocular palsies, hemiplegia, quadriplegia, cause tremor, altered sensorium, progressing to coma. This will be the encephalitic stage. Person may pass away in this stage. Uh, the late stage and sequel, if the person is successfully combating this stage of acute encephalitis, then he will go into the later stage or the sequel where the neurological symptoms are getting better, the temperature and ESR come back to normal. But most of the mortality, it happens at this stage. Control of JE, we have got vaccination. So three types of vaccine is there, but remember the live attenuated vaccine SA1442 strain of the JE virus. So this one also the name of the vaccines you remember. So I hope now by now you understand when I say remember 17D vaccine, the cholera vaccine name, the typhoid vaccine name. Now by now you might be understanding what is the reason. So could be asked for a MCQ and also as an option. So better to know. So SA1442 vaccine is for actually JE virus. Then vector control. Vector is our Culex mosquitoes. So control them. We can do the aerial or ground fogging with ultra low volume insecticides, mainly malathion and fenthion, and even indoor residual spray that is within the house, and also the vegetation around the houses, the breeding sites, if there is some water accumulated area over there, animal shelters, etc. The villages within the proximity of infected villages should be kept under surveillance. The surveillance means we have to actively monitor, watch whether any cases are developing over there. And for personal protection, use of mosquito nets and also mosquito repellents are advised. So in a single slide, this will be the symptoms, the transmission, the signs and symptoms, prevention, the treatment. There is no specific treatment, only symptoms and complications may be treated. Lastly, dengue fever. Dengue viruses are arboviruses capable of producing classical dengue fever, dengue hemorrhagic fever without shock, and dengue hemorrhagic fever with shock. So dengue fever, three varieties are there. The classical dengue fever, which is not that dangerous, which will be characterized by high fever, chills, and also the body pain and other constitutional symptoms. But then if hemorrhagic symptoms are appearing, because this is a fever which is characterized by decrease in platelet count, so there will be some hemorrhagic symptoms. In that case, if it is there is dengue hemorrhagic fever without shock, and then if the hemorrhage is happening in a massive scale, then that loss of bleeding can result in shock condition. So then the third variety, that is the dengue hemorrhagic fever with shock. Over the past 3 decades, there has been a dramatic global increase in the frequency of dengue fever, dengue hemorrhagic fever, and also dengue hemorrhagic fever with shock. Uh, it is called as dengue shock syndrome, DSS, dengue shock syndrome. And this risk of dengue has occurred recently due to rapid urbanization, lifestyle changes, and deficient water management, including improper water storage, leading to proliferation of mosquito breeding sites. Agent is usually the dengue virus belonging to the genus Flavivirus, and there are 4 in variety: dengue virus 1, 2, 3, and 4. Vector is the mosquito Aedes aegypti and Aedes albopictus. So mostly the Aedes variety. So we have the symptoms over here. In case of dengue fever, there will be fever with two or more of the symptoms, headache or retroorbital pain. Retroorbital pain is more characteristic. Can be myalgia, arthralgia, rash, hemorrhagic manifestations, but usually very less, and no evidence of plasma leakage. When we do the lab finding, it will be leukopenia, thrombocytopenia, and rising hematocrit. Rising hematocrit means RBC will be increasing. That is why hematocrit value increases. And it is not that RBC is increasing, it because the other blood components, the WBC and the platelets are decreasing. So we feel like RBC count has increased. So RBC per se has not increased. It is because the other two, the WBC and the platelet count has reduced. We feel like the hematocrit or the RBC count has increased, but it is relative. It is not increasing per se. Then dengue hemorrhagic fever, we have type 1, 2, 3, and 4. So if it is type 1, there will be above features what we discussed in the dengue fever plus hemorrhagic manifestation plus a positive tourniquet test. They will be tightening or binding a tourniquet and to diagnose the hemorrhagic thing, whether it is hemorrhage itself or some other rashes. To diagnose that, they do the tourniquet test. So that should be positive, which shows there is hemorrhage actually. It is not any rash. Because this one in the dengue hemorrhagic fever, it will be appearing as small pinpoint petechiae, what we call, or sometimes purpura. Not the bigger one, not the ecchymosis. It will be usually the type 1 will be petechiae, a small pinpoint one. So then we don't know whether it is a rash or actually a hemorrhagic spot. So they tie a tourniquet and check it. So even if after tying the tourniquet, if it is present, present or absent, I have a doubt. Like I didn't check it. But if it is positive, then it will show. I think positive means that point should be the hemorrhagic. Then if it is remaining though, it is hemorrhagic condition. So positive tourniquet test, still you read and confirm, okay? I'm in a doubt, tourniquet. Then in that case, the lab finding, the platelet count will be reduced. In the first condition, the platelet count will be less than 1,50,000. And here it will be less than 100,000 or less than 1 lakh. And in type 2, the above symptoms plus there will be increased bleeding, spontaneous bleeding uh, in skin or other organs. Even evidence from hematochezia or the stool, it is mixed with blood. So the stool appear black tarry, epistaxis, bleeding from gums, etc. So even in that
Can hear?
I did
No,
not
I
hear
can't
anything
hear.
suddenly.
Can't hear.
Okay. I think Dr. Mila said.
Okay. I hope I can be heard.
Yeah, I can hear. Can see.
Okay. Can you see the PPT?
Not yet.
Okay, I'll have to share once
Not
again
yet
as well.
see the PPT.
Okay, maybe I'll have to share it once again. Now?
Yeah. Can see.
Yes,
Okay, I
can.
think I did you hear until I think you heard about this one, dengue hemorrhagic fever type 2 or the category 2, maybe. No, we lost from this type 3 and type 4, I guess. Until what did you hear? You did
Type
I
2.
lose you again? Type 2, okay. So in case of type 3 and type 4, the shock symptoms are coming. And whenever there is a shock symptom means there is a circulatory failure, which means the BP is reducing. So that is why the pulse pressure will be more than 40. Not more than, it is less than 20 or equal to 20 mmHg, because usually the pulse pressure is the difference between the systolic and diastolic, and that will be 40. But when the pressure is dropping, that pulse pressure, that difference will also be increasing or decreasing. What happens if it is 1 minute? Let I make the calculation. 120/80, it will be 40 mm the pulse pressure. And if there is a high diastolic pressure, so 120, if it is becoming 100, so diastolic pressure increases to 100, which means the pulse pressure, it will be less than or equal to 20, not the normal 40. So there can be hypotension with cold, clammy skin and restlessness. That is the shock symptoms. And in for this itself, but in a very serious condition where the person has gone into undetectable blood pressure or pulse. So if it is going to stage 3 and 4, if we are not able to manage that shock, then the person will be going to death even. So this will be about the dengue fever, the symptom, the diagnosis, treatment, and prevention, whatever we have discussed. other?
Yeah, can hear.
But it's still showing some symbol that it is not there. Uh,
Oh, yeah. Please, okay.